Welcome, respected doctors. It is our project Medicine Info, and we have a team of 4 members. Their names are Rajiv, Vivek, me, myself, Sweta, and then Suman. So, you can next person. The brief overview of our project is a digitalization of medical records. Suppose in our country, let's take example of our country, Nepal, we don't really care about our medical histories. Doctor writes out prescription, we go home and throw them away, or we don't care about those prescriptions, which is very crucial for our health. And when we go hospital for next time, we don't really carry those medical histories, and then doctor can give us the right prescription or right medicine, which causes lots of problems here in Nepal. Then our targeted, basically our project is more related on micro-workers. So our targeted micro-workers are medical students, and then HCC people who sit on their clinics for all the day, selling the medicines, who really don't have much work. They can on more things. And then we have staff nurse, health assistant, compounders who really understand what doctor have written. And we have lots of micro-workers in our country. Next. Problem statement. As I have already discussed, we have lots of problems going on about medical records. We really don't care, and there are lots of people who are not so literate, those who think that's important. And this is our working procedure. Someone from the hospital scans those prescriptions and then goes to our organization where it will be listed as a job. And then those jobs will be given to the digitalizers who will digitalize those prescriptions. And then when they submit, they goes again as a job to the organization, and those jobs are again verified by 2 people. Unless those people, if one of those people down on the correct text, it will again go as an incorrect information, and that job will be again sent to the same digitalizers, because he has done the job and he needs to get his money. So it will go to the same digitalizer, and then again the verification process. It will be 2 times verification process by 4 digitalizers, and if it goes on the loop for more than 4 times, it will be sent back to the organization experts who will handle those things. And then as a security or privacy thing, as a health reports are privacy related things, we have divided our prescription in 3-part: problem, diagnosis, and treatment. And these parts will be sent differently to the different micro workers, so they cannot relate any one of the patient. And this is our business model. What we have thought of is like for now only. There will be 15 rupees, which will be divided into 80% and 20%. 80% to the micro workers, because they will be doing a lot of work, and 20% to the organization. And then problem is when digitalizers get 2 rupees for each work, and verifiers 0.5 for each work. So this will be the paying model. And as we know, there are lots of benefits. Patient gets benefit for the proper medical service, and then their country can do lots of research thing. Why do people are dying from village areas due to common cold, or what they have the medical history? There can be lots of work we can do after the digitalization of the medical prescription. Let's go to the demo thing very quick. Here you can have. We have a mobile app. There is a username, password.
You have that.
Okay. I email admin and password paste. We have also done the web part where hospital can update their records, and doctor can view patient's medical history. And yeah. already log it because the same person has logged from that side. No one can log 2 times.
Okay, this Q&A time starts right now.
We logged in. We have 3 users and all are logging. Just waiting.
So, brothers, do you guys have a question?
And I will log out.
I mean, just a small question while you are working on this. Are you targeting the hospitals, the nursing homes, or individuals?
Micro workers will be the individuals.
Not the micro workers. Who will pay?
But hospitals will pay some amount and the patients will pay some amount. Like when they buy a ticket, they will, the whole amount will be equally distributed among patients and the hospital. Because if some patient pays 250, we can get 5 rupees, add 5 rupees on patient and 5 rupees from hospital.
Say if a patient goes to 3 different doctors in 3 different nursing homes,
And doctor can view those information, his past medical history from his ID. Patient will have a unique ID.
that's something you might need to work on. Just an idea,
Yeah.
not a question.
What is 2 rupees and 0.5 rupees, right? For verifier.
Yeah.
And for digitizer, it's 2 rupees. Why is there any?
No, it's just a model what we have supposed in our project for just now.
It's like the digitizer has a lot of work, so it's 2 rupees, and the verifier has to do this work. You just have to take the 2 things, so it's 0.5.
But the image I get when digitizing the image, the size might be different.
Yeah, we have also worked in those landing. And then when the image is downloaded and uploaded, it's like 40 KB that user gets when downloading and uploading one task, and 40 KB is like 0.0 rupees, 0.07
One
rupees.
final question to Mark, please.
So obviously it's a hackathon, and we're not thinking a lot about security and things like that, but anything medical related is obviously a concern for people. Do you have any ideas, as you further developed it, on how you would handle the idea of the digitizers, the micro workers having access to this fairly sensitive personal data? Any ideas on how you could make people feel more comfortable with making their information available to people?
Like those information won't be able to download it by micro workers. And in the
They're going to see, right? One of the digitizers could be a family relative, right? Would
no,
they see?
they won't get the information about the patient. They will be completely unknown about the patient information. They won't get the patient ID. They won't get the patient ID. We have generated token, which will be auto-generated token, and we will be working on that page of the token.
So the name is not written on?
No. We have made it like secure and privacy thing.
Is there a time?
And due to like they need to get they expand like 0.07 rupees on their task, and they will be getting 0.5 or 2 rupees, and I think that's a really big amount.
Sorry, Mohammed Zee. Shall we take final question? One final question.
When I meet with a doctor, what I do is I have a prescription and I get home, right? That means every doctor needs a scan like that, right?
No, we have supposed here is like when a doctor writes a prescription, and then patient need to get that prescription from the reception, so that the prescription is sent to recipient and then reception, and then patient will get those prescription, hard copy from the reception. So when it goes to the reception, they will scan. We have supposed those things, but it's not final. We can work on that.
Okay, thank you very much for